Hey everyone, and welcome back to our podcast, The Art of Divergence, brought to you by Neurodivergent Ohio. We're your hosts for today. I'm Heather.
I'm Sammy, and the information provided on this podcast is intended for informational and entertainment purposes. It does not act as a substitute for the diagnosis and treatment of any mental health concerns. Today, we are going to be talking about jumping off of our part one on general gender differences when it comes to people with ADHD, talking about hormones and how they affect the presentation of ADHD, the diagnosis, and what might exacerbate or actually complicate the diagnosis of ADHD when it comes to specifically our sex hormones. To start off, a general explainer of hormones, they are the chemicals coming from adrenal glands, which sit on top of our kidneys, and our sex organs, which go to the brain and other organs. They determine lots of things about the ways our bodies function, and any sort of dysfunction with them can have some clear effects on our cognitive function. So, Heather's going to go into some of the specific female sex hormones and how they present over the lifespan, how they interact with the symptoms of ADHD and the diagnosis. And then, if we have time, I will go into the male hormones and, you know, talk about the lifespan and diagnosis specifics as well. If we don't have time, we might end up making a part 3, but we will see if we can be straightforward and to the point. So, Heather, go ahead and tell us about the female hormones and what the deal is there with those over the lifespan.
Sure. So, this is where it gets a little tricky for females and why there's a lot of complications that we tend to see when it comes to hormones in females. And there are two essential hormones. We have progesterone, which impacts things like emotion regulation, and estrogen, which regulates your neurotransmitters. So, your serotonin, your dopamine, and all of these are important for mood, motivation, attention, a lot of the things you see with ADHD. So I'm going to ask you to visualize with me here for a second. We're going to do a little bit of a line graph. The body has three main points throughout the menstrual cycle that are going to be important to this visualization. So the very first part is the follicular phase. And this is usually the first 2 weeks of your cycle up until we hit the point of ovulation, which is where you'll find a lot of the body is primed and ready to prepare for pregnancy. And then you have the luteal phase. And this is basically the end of your menstruation cycle, the last couple of days of your period. And what we tend to see, we'll start with progesterone first, is this one is skewed. So it starts off very slow at the beginning of your cycle in the luteal phase. And as it goes through ovulation into the luteal phase, it peaks. And what happens when progesterone peaks is you have more dysregulation, irritability, impulsivity. All of those signs are symptoms of ADHD. So we're seeing those exacerbated symptoms happen towards the very end of the cycle. Estrogen is a little more complicated in the sense that it has a lot more ebb and flow. So it increases slightly at the very beginning of your follicular phase and then peaks off and drops to its baseline before increasing again to ovulation. Once you've hit that ovulation period, that's where we tend to see its peak. Unlike the progesterone, where you see a lot more negative symptomology coming through, with estrogen, what tends to happen is your focus levels tend to increase. And so that's your peak point for where ADHD symptoms might not seem present. Hormones are helping you stay motivated and attentional in your situations. So then we have the drop off again, and then a little bit of another peak towards the end of the luteal phase. But in general, the ebbs and the flows, your body is constantly saying, hey, I can focus. No, I can't, depending on where each phase is in the cycle. And in general, females have their regular menstruation usually starting between the ages of 10 and 15. So that number kind of can change, right? There's people as young as 8 that I have heard, and some people don't get it until they're 15, 16 years old. So everybody's different. Bodies work a little bit differently. But it's important to note that what we tend to see is these hormones that are fluctuating up and down can be very difficult for girls as their bodies change and they're experiencing new feelings and new things are happening that never were experienced before.
Yeah, I think it's important to know, this is also puberty for males and females is also the prime time for ADHD diagnosis. And so as all of these hormones are fluctuating, all of these symptoms are overlapping, and I'll talk about that more with males as well. There is a big difficulty in pinpointing if it is ADHD, if those hormones are having a severe enough impact on you. So that is something to really take into account as a parent, as a young person, about when you're zoning in on these symptoms and trying to figure out if ADHD is your struggle early in life. And then, as we get a little bit later into teen years or young adult years, we're usually taking birth control, a good portion of us. What's important to know about that is some birth control methods affect our hormone levels. If they drop our progesterone too much or just mess with the levels in a way that our body does not like, we can see a depressive effect. It can mean that our mood regulation and the ability to get enough serotonin just kind of drops off. And that means usually that birth control is not good for your body. But we also know that there is a crossover between ADHD symptoms and depression symptoms. So it can get all confusing and discombobulated and crossover with each other. So that's another thing we need to look at as we are seeing ADHD symptoms is our birth control, if we are using it, right for us and regulating our hormones in a way that is manageable and not impairing as well.
Absolutely. Yeah, and you brought up the depression in there, and I want to hit on that for a second. So, there's actually a huge correlation we tend to see for individuals with ADHD, women, and PMDD, or premenstrual dysphoric disorder. And this is basically a more debilitating form of PMS, specifically behaviorally, physically, mentally increase in symptoms. And you usually see that about 7 to 10 days before menstruation starts. And there's upwards of 40% of women, according to the Journal of Psychiatric Research, that experience ADHD with ADHD. This is also important to know that depression piece where if you've been diagnosed with PMDD, a lot of the times you'll see an increase in depressive symptoms. Actually, women are 3 times as likely to experience postpartum depression if you have PMDD. So, keeping in touch with your doctor on medication, how you're feeling, know that you're not alone. This is something, like I said, that is happening at a pretty alarming rate for women, and is something that if you've been struggling, talk with your doctor if you feel like there's something more that's been going on, because this can really tend to be an explanation for why things feel so unmanageable, and especially maybe emotionally and mentally, where you're feeling just kind of defeated, feeling very low. There could be some other things that are going on. Increased irritability.
Yeah, I agree, and I think that those symptoms are sometimes really just overlooked in women,
Mhm.
or pain and symptomology is generally overlooked in the medical community. Self advocacy is so important. I think our pain and symptoms as it relates to the menstrual cycle is so specifically overlooked because in a field led mostly by men, we just aren't validated. Unfortunately, we are seen as more dramatic or not accurate in our reporting, or, like we are just supposed to be enduring these things. And let me tell you, as someone who's tried to navigate their symptoms and found someone who listens and validates, if you have severe symptoms around your period, you should be telling someone and they should be giving you options. That's the bottom line. If you are experiencing this point of time before your period where you're experiencing extreme stress, extreme anger or sadness, inability to do anything like an episode of depression, feeling like you're in a manic state. It could be a lot of those different things. It could look like a lot of those things. And we don't always line it up because we are mostly told. I mean, I guess I'm speaking with a little bit of bias because of my experiences, but we are told very frequently that this is something that we just have to deal with and it's normal and see if it, see if it goes away with time, or let's put you on an antidepressant and we'll just, see what happens. When clearly it could be a hormone issue. It could be a need for a more specific hormone balancing treatment or approach, and we don't get the, validity and relevancy to get the option of those treatments and interventions. So it's really important as a woman, hear me when I say, if something feels off, just say something about it, and say something until someone gives you the option to do something about it. Even if it doesn't feel very severe, we also remember that a lot of the time women are conditioned to make less of our symptoms and not communicate the full intensity of things and just grin and bear it. And so maybe question with yourself, is this something that seems really bad to me, but I don't think is appropriate to tell how bad it is to everyone else, especially my doctor? So that, I think, is a very important thing to remember as we are trying to figure out this balance between hormones, ADHD, and depression.
Yeah, absolutely. I was actually watching Landman the other day. I don't know if any of you have ever seen it, but there's a point where Billy Bob Thornton's character is asking his ex-wife, "Where are you at in your period?" Because she was crying, she was irritable, she was stressed out, kind of all over the place. And I was like, you know what? Even in entertainment, it is being brought up as a negative thing. I found myself laughing at it at first until I thought deeper about it. And then I was like, dang, it's a jab, you know? And so it's things like that where, maybe there's something more going on for this lady that is, doesn't know what's going on and you don't know what's
Yeah.
going on. That's for sure.
Yeah, I saw that as a clip on,
Mhm.
Instagram or something, and I'm like, "There's a reason they clipped that. It's because men just think that way, unfortunately." And that's why, men, if you're listening, this is a good thing to pay attention to, because if you can be empathetically aware of where your female partner, if you are in a straight relationship, might be, or for other women in your life, even friends, honestly, it's just good to know how to support them and understand this side of their biology in a way that is not insulting to them and puts the responsibility on them to explain everything about themselves and also keep it all contained and also treat it all.
Yeah, absolutely. I think in our society, if men were able to understand kind of what all was happening in that process, then there would be a better understanding, hopefully, of the needs and, "Hey, don't take this personally. Sometimes this is just what I need because my cortisol levels are a little elevated today," right? So,
Yeah, absolutely. I think that's also why we see so many relationship issues when it comes to people diagnosed with PMDD, premenstrual dysphoric disorder, postpartum depression, and menopause, perimenopause. These are very high risk times for relationships a lot of the time. And women, we have to do our part, obviously. But men, if you were able to get on the same page with us about where our hormones are, I think it would be a lot easier to navigate some of the relationship stresses that come up. And I think, Heather, you were about to talk a little more about the postpartum depression aspect as well.
yeah. So, with the postpartum depression piece as well, some of the things to keep in mind are medication is typically stopped for women who are pregnant with ADHD. With postpartum depression, you can stay on those SSRIs, the SSNRIs. Those are meant to help regulate your mood, do everything to help reduce that anxiety. And so coping skills are super important around that time. Being able to be honest about what your experience is with your support people, with your doctor. And this is something that happens frequently for a lot of women. And it's nothing to say anything about you as a parent. And it's nothing to say anything about the child. It is your body and your hormones just doing the fluctuation, trying to get back at its baseline. And sometimes it might take a minute for that to readjust. So be patient, talk with your doctor, be educated, and just know this is something that happens for women and it's not something that is a result of how you are as a parent.
Yeah, as a parent, as a woman, mother, not that I am one or have experienced that, but my best advice would be to do your best to suspend your self judgment until your body is taken care of. I know I can't convince everybody not to judge yourself. That's a really hard thing and it takes a lot of time. But if you can suspend it to take care of your brain and body first and see if there's issues there, you might find a lot more room to be kind to yourself.
Absolutely. So yeah, so women who are pregnant also experience a lot of their fluctuation in their body, but also in their lifestyle changes. Things they maybe were able to do prior to getting pregnant, they might not be able to do any longer. So things like exercise, right? If you were a hardcore runner and power lifter, what have you, doctor's going to say, "Hey, we don't want that baby coming early." Like, here's some appropriate exercises you can do to continue to feel healthy and, stay healthy for your baby.
And
I
that's
mean,
so huge because exercise is one of the top things that can help regulate your hormones and help your ADHD. So if you're a person with ADHD with a really strict or heavy intensity workout routine that you know helps your brain, you feel the positive effects and then you have to stop, that's going to be, you're going to feel that drop off. So we do have to come up with ways to compensate and be very intentional about that lifestyle shift. So that's a good point, Heather.
yeah, absolutely. And I think one of the biggest things is trying to be flexible, being flexible and not so rigid in a routine that when it does change that you feel like you're starting back from the beginning. There's probably going to have to be, finding new hobbies, finding new outlets for stress, finding more things that regulate you. Maybe it's reading to your child at night. Maybe it's putting headphones on your tummy instead of, jamming out to an electric guitar to, Metallica and, you're bouncing around everywhere.
No, absolutely. Sometimes we do really have to change the intensity of our lifestyle, and that can be really hard, especially if we just, as ADHD people, function on the dynamics of our lifestyle. We like the novelty, we like, fluctuating levels of energy. And so, yeah, ooh, can't imagine. Not planning on being pregnant myself, but I know that would be so hard for me.
I agree. I don't know how I'm gonna feel when that day comes. So,
Well, best of luck.
all right. So then we get into the perimenopause, premenopause stage where you're in your 30s, late early 30s, early 40s, and this is where we see the frequency and the heaviness of the cycles start to decrease. So hormones might start to get a little off track, fertility will decrease, estrogen levels will fluctuate even more than they already do. And that's where you'll end up seeing difficulty in things from like attention to foggy headedness, those kinds of things that we typically see with ADHD. The frequency and fluctuation just might be a little more intense than what the baseline is for each individual female. And then we get into menopause, which is typically 1 year with no period, where women will have little to no estrogen, progesterone, no longer ovulate or release eggs, and are no longer able to reproduce. So we're not seeing as much fluctuation in the hormones, not so many highs and lows, and then not so much difference in ADHD symptoms. Symptoms might tend to feel a little more consistent as your body finds what its baseline is now that everything has kind of slowed down in the body.
Yeah, what I've heard is that women experience a higher intensity of ADHD symptoms during perimenopause and then once again kind of a drop off with menopause.
Yeah.
But I think that covers the lifespan when it comes to women. And so now we'll get into a little bit about male hormones and development. So we got testosterone for males. That's the hormone. It's responsible for gender trait development just like in females, and the psychological effects of it are usually the control of aggression, more dominant behavior, and risk-taking. Testosterone plays a significant role in the dopaminergic system, which is a system in your body that basically produces the dopamine, tells how sensitive the brain's receptors to dopamine are, and tells how effectively the dopamine can get messages from the frontal lobe, which is our working brain, to the deeper parts of the brain. So it's highly involved in ADHD since ADHD most frequently affects the frontal lobe. And when it comes to the highs and lows of testosterone, it is mostly spiked in fetal development and then in puberty.
Yeah, so with testosterone increasing during puberty, you might find increased hormone levels that can reduce medication effectiveness. This is similar to something we see in females as well, is when there's too much of that hormone in the system, the body is going to reject and make the medication less effective. Also, you'll see an increase in impulsivity, frustration, maybe some of that aggression coming out externally, since that is what we tend to see more for boys and men is it comes out a little more externally, hyperactivity, impulsivity, all of that.
And that's why we see such a spike around this time of ADHD diagnosis, like I noted before. The high levels of the hormone can cause symptoms that both mirror and exacerbate ADHD. So if you don't have it, you might look like you have it. If you do have it, it's worse. So then later in life, kind of the reverse happens where low signs of testosterone can also overlap with symptoms of ADHD. That is essentially because it's a system of needing a balance. Too much is bad, too little is bad. So, some signs of low testosterone can be low motivation, fluctuations in mood, low energy levels, decrease in focus. And obviously, all of those things, like I said, line up right with ADHD. This, I don't think, is commonly, but can result in a misdiagnosis of ADHD. Generally, with ADHD, we are seeing a consistency over the lifespan. With low testosterone, it can be a little shorter or more temporary, but it can happen. So, if you're already diagnosed, then it can mean a compounding difficulty with these symptoms of ADHD. So, with that specifically, I know that was a lot less coverage of men's lifespan, but fortunately for them, their development is not all wonky like a roller coaster like ours is. So enjoy that. The point there is just like clearing the bar, like I've said before, clearing the bar of ADHD is important, but also checking hormone levels, in men's case testosterone, in women's case progesterone and estrogen. And women also have some levels of testosterone that play a role there, but we don't see it as affecting these type of symptoms and systems as severely as the main ones for each gender. And when we're talking about all of these different systems intertwining, what we can also see is chronic stress over the lifespan, and chronic stress increases cortisol levels. Cortisol is the stress hormone. Over time, high chronic stress, high chronic cortisol can honestly damage the brain. It can have a lot of negative effects, and essentially it can lower the effectiveness of the hormones we're talking about today because chronically high cortisol suppresses the body's system that makes those hormones. So, untreated ADHD can realistically cause that kind of stress because there are constantly repeating patterns of feeling behind, not feeling good enough, or like you're always failing. And that can definitely create that type of chronic stress that raises the cortisol so regularly to have an effect on hormones. So, just like you need to be managing the hormones, you need to be managing the ADHD so they don't affect the hormones. It is all a big intertwined system. So, our takeaways for today through all of that are that any hormone dysfunction can very easily affect and exacerbate ADHD or could even be confused for ADHD if severe enough. Otherwise, know your levels of hormones, pay attention to them, pay attention to the regular things your body should be feeling and what feels irregular, and pay attention to them in your kids and family as well. If you can maybe highlight some dysfunction for someone that they may not notice themselves.
Yeah, and one more thing I was thinking of is if you are noticing from somebody else that they are saying, "Hey, like what's going on? Why are you being like this? You seem like there's something that's going on." And it's coming off as a little extra. Sometimes it's okay to listen to what your partner or a family member or a friend are saying and do some reflection. I will say first and foremost that it took someone in my family to point some certain things out for me, and I wasn't in a place to hear that until I kind of did some reflection. And I was like, you know what? Maybe it's worth getting this looked at. And then I took their advice and I did. And my world is forever changed for that. So sometimes, even if we don't want to hear it in the moment about the things that we're doing wrong or the things that feel like they're stressing us out, sometimes somebody else pointing it out might give us some time to think about something that could change our life.
I'm so glad to hear that that positively affected you. But yeah, we have a natural defensiveness towards that. I mean, especially as women, I think we have our protective factors up for not feeling insulted by just being how we exist, existing how we are. And I think it's really important to understand that, yeah, as you're experiencing impairment and dysfunction, the opinions of others around you, especially those that care about you, are really important to take into account. So that's a good takeaway too. Overall, understanding the importance of managing hormones if you are someone who has ADHD and managing ADHD as someone who has to balance your hormones, both are very important. So I think that sums it up, all the information we wanted to get through today. Thanks for listening to The Art of Divergence, a podcast brought to you by Neurodivergent Ohio. We are a counseling agency based out of Ohio, specializing in treating neurodivergent individuals. We offer assessments, counseling, and community building. Join us next time, where we will be talking about ADHD in the older adult community, those age 55 plus. Thanks for listening and have a wonderful day.